welcome first Dr. Suresh Kumar. He's the medical director at the LNJP hospital in the capital, which is where one of the monkeypox patients is being treated. The first patient in Delhi who didn't travel abroad but somehow managed to contact monkeypox is being treated under Dr. Kumar's personal care. So we'll ask him how that's going. We have Dr. Shahid Jamil, leading virologist, fellow at the Green Templeton College, University of Oxford in the United Kingdom, one of our leading virologists. We've got Dr. Chandrakant Lahiria, epidemiologist and vaccinologist. With us on this broadcast is Dr. Pragya Yadav, scientist at the Indian Council for Medical Research, the National Institute of Virology, NIV. We've got Ambrose Pradeep, is the Chief Medical Officer of YRG Care, that's the YR Gaitonde Center for AIDS Research and Education, which is a non-profit organization in India working in the sphere of sexually transmitted diseases. Last, Harish Iyer, equal rights activist and columnist. So welcome to all our guests. Let me go across first and foremost to Dr. Suresh Kumar, who has a patient on his watch at this moment who's suffering from monkeypox. This patient, from what I've read in the story filed by Sneha and Milan, didn't travel abroad and therefore managed to contact the disease, apparently on some kind of a holiday he'd taken with his male friends. Can you tell us how this patient is doing? How badly off is he? How do you think he could have contacted the disease? And what do you make of what you're seeing around you at this moment? Dr. Kumar.
This gentleman was admitted in our hospital, Loknayak Hospital, 3 days back, and he had a history of fever and skin rashes. These skin rashes were first appeared in the lower limb and then abdomen and thorax, and then gradually on the face and on the palms. So the classical skin lesion along with the history of travel inland, not international travel, but this patient had a typical skin lesion. So initially we thought that it is a suspected case of monkeypox virus because we have not seen any case of monkeypox virus in national capital. So this was kept in the observation and we sent the sample to NIV Pune, and just on the Sunday we got the report that this person is having PCR positive case of monkeypox. So we don't know how exactly he acquired the infection because he has a history of domestic travel. Earlier we have seen that the cases in the Kerala, they have the history of travel to the Middle East or Dubai, but this case never traveled abroad. But this patient have a classical skin lesions, and we all know that this is a zoonotic disease initially found in the Africa, and then we have seen more and more countries reporting this monkeypox cases. Right now we have the 4th case reported in the country, and this is stable right now. His vital parameters are stable and he is recovering well. We hope that he recovers in a few days.
Dr. Shahid Jamil, virtually everyone watching at this time would wonder, what does WHO declaring monkeypox a public health emergency of international concern mean in the real world? How scared should we be at this moment? How does this compare with the COVID pandemic?
Well, I mean, these are two completely different viruses, but let's come to the WHO decision first. If you recall, WHO came under a lot of bad press, a lot of criticism for not declaring COVID as a global health emergency early enough. So one is, a case of being more proactive this time, but importantly, declaring it as a global health emergency will now help focus attention on this disease. Remember, we are in a pandemic, so a lot of attention is on COVID, and understandably so. But this declaration also puts onus on various governments across the world to pay more attention, WHO itself and its systems to gear up towards vaccines for monkeypox that are available but not available in enough stocks, a drug that is available but only an investigational drug which can be used through proper authorization. So I think the main reason for this has been WHO's uh, WHO wanting to focus global attention on this disease. After all, in the past few months, there have now been almost 17,000 cases being reported from 75 different countries. This has never happened earlier for something like monkeypox.
No, but what's different? From what I'm reading, monkeypox has been around from at least 1970. If that is the case, then why is it spreading more now? Apparently the first case of monkeypox in humans was reported in 1970 in the Democratic Republic of Congo in a 9-year-old boy. In 2003, monkeypox outbreak was reported for the first time outside Africa, and the United States was linked to the contact with an infected pet prairie dog imported from Ghana. So what's changed now and why?
Well, we can only speculate at this time because we don't know the real reasons. I mean, I would be very concerned if the real reason is that monkeypox has also gone into rodent populations in the countries that are being affected. But most likely this looks like the virus has exploited a very close network, and this is the MSM network. But going back to the discussion that was happening earlier in the clip that you showed, I really don't think monkeypox can be called a sexually transmitted infection. That's one route of transmission if the lesions are present in the genital area, but otherwise it's not. I mean, it's transmitted through close contact, it's transmitted through respiratory droplets, but it's not necessarily a sexually transmitted disease. So to answer your question, we can only speculate. I don't think we'll have an answer till we do more surveillance.
Dr. Chandrakant Lahiri, at this moment, what are the lines of treatment? If, God forbid, somebody were to have suspected monkeypox, in terms of getting tested, what do they need to do? In terms of medicines, what are the medicines available? What kind of vaccines are there? Do we in India have access to those vaccines?
So what we know that monkeypox is largely self-limiting viral illness. So
what does that mean?
It means that usually symptoms are mild and person recover without any medication. So what is required, usually if person has a fever, then you manage the fever, or any other symptoms. If rashes are there, you just take care of rashes. What one need to worry if there are complications, and which complication could be any part of the body, and including lungs, etc. So you have to take care of complications. So what happens, majority of patients recover usually in the longest period of 4 to 5 weeks, but they recover fully. And the example is that though in the non-endemic countries outside Africa, though around 15,500 cases have been, confirmed cases have been reported, but there has not been any death outside Africa. So this is a fairly self-limiting disease. Having said that, there are one medication, therapy tecovirimat, antiviral, which was originally developed for smallpox, has been approved against monkeypox, but again, this is available limited stock in a high-income country, European settings, and United States.
So do we have it in India?
To my knowledge, it is not available in India. It's only.
Should you think if the government is watching at this time, you would encourage them to start buying and stocking up on this antiviral?
I think this is what going to happen with both antivirals as well as vaccines, because there are a few smallpox vaccines also which have been given emergency use authorization in European settings and United States and Japan against the monkeypox. But again, those vaccines are not available in India. So once this is declared as a public health emergency of international concern, all countries, including India, should explore how to secure some stocks of the tecovirimat, the therapeutic, as well as that of the vaccine. Also, the National Vaccine Committee should be looking at that if vaccines, like how to procure the vaccine, and once vaccines are available, because those are irrespective of whether we have or not, are going to be limited stock, how to prioritize those vaccines. So definitely, even though
do any of the Indian companies manufacture these vaccines?
No, there is no Indian company which is manufacturing the vaccine, because this is only the second generation and third generation vaccine, which are really relatively advanced than the original vaccines which were used for smallpox eradication before 1980 were manufactured in India. So the second generation and third generation which are recommended for monkeypox are not available in India. But I am sure with this kind of public health emergency being declared at the global level, there would be collaboration, and that's what the focus should be, to procure and have a collaboration to produce vaccine in India, or if that is not immediately possible, then secure some stock.
Now, Harish Iyer, we saw how even some doctors are convinced that this is a sexually transmitted disease, even though genuine bona fide experts are saying it's not. Sexual transmission is one line in which the virus can be spread. There are multiple other ways, including close contact, droplets, bed linen, coming in touch. Therefore, there are other ways in which monkeypox can spread as well. But the message that seems to have gone on, there's a lot of disinformation around this, is, and it's, in some senses it is true that largely it is spreading from intercourse between men. So there is A, misinformation, B, in part it is also true that monkeypox is largely spreading through men, even though that's not the only way in which it can spread, and therefore it almost certainly isn't a sexually transmitted disease.
Well, thank you first, Rahul, for speaking about this issue, because I think we should be proactive in speaking about these issues. Secondly, we also need to exercise caution when we speak about these issues, because this could lead to the demonization of an entire community of LGBTQ people. It is true that that the case history has been of people from the community, but we need to look at them as not as super spreaders, but as people who have been victimized, and it's been in that close population, we don't know if it spreads through intercourse, but it definitely spreads through close physical contact. So it could be a small population which has been affected, and this is the same thing. The same stigmatization is something that WHO warns us about as well in its press release. What it actually says is that this should not reach the levels of stigma. It's been an awareness drive from WHO, where they've said that it has been found in this community, and because this community is marginalized and we live in close proximity with each other, we could have partners in this community. It is spread in this community, so we need to be cautious about it. Also, we need to take lessons from the AIDS pandemic that we have had. It was called the it was called GRID at one point of time, and it was something called as a gay disease. But later on, we found out that it was not just homosexuals, but anyone, and there were many other modes of transmission. Same is the case over here. It's not a sexually transmitted disease. It is a disease where people come in close contact with each other and it spreads. And we need to fight against disinformation that could spread to epic proportions and stigmatization for the LGBTQ community.
Dr. Ambrose Pradeep, you spend a lot of time in this space doing advocacy, doing research. Harish Iyer makes an important point. You need to prevent stigma. But just given how human beings are, in the way that word travels, generalizations are abound. Therefore, how do you prevent that stigma from spreading, and just ensuring that it doesn't just go out that this is basically spreading through sex between gay men, which isn't the case?
No, I think I agree with Harish. I think it echoes the way things are being portrayed now. It echoes like how it started with HIV, like it was called GRID. And it was predominantly thought a disease of gay men. So what actually happened was the rest of the community were actually left out before you realize that everyone in the community gets affected. The same thing is happening probably here as well. I think it's not a sexually contracted disease. It is a disease which spreads through close contacts. Probably the fact that it started off with in the gay community, and we just had a Pride Month in the month of June. It's probably the reason, a lot of gatherings has probably helped the spread of infections, but we probably need to look at other communities as well. It's just not limited to gay men or bisexual men. And I think we should stop using these headlines that says gay or bisexual men. To also reiterate, even with HIV, when it was first identified in India, it was identified in commercial sex workers. That's probably why it's still stigmatized that, people are always judged as to, with a moral compass, thinking, anybody who has HIV invariably would have had to go to a commercial sex worker or something like that. So breaking that initial line or a statement that somebody makes it's very difficult in the community. So I don't really know. So the only thing that you can probably do is take out that tag that says that it's a disease of gay men, and probably try to promote it as a disease that spreads through close contact.
Dr. Pragya Yadav at the National Institute of Virology, where you're also a scientist at the Indian Council of Medical Research, when you look at the manner in which these reports are coming to you at the NIV, and the most recent example is of the COVID pandemic, when you compare the two viruses in layman's language, what are the similarities, what are the dissimilarities?
So thank you, Mr. Rahul. Similarity, and it's very difficult to compare these two diseases. They are very different diseases. Like SARS coronavirus transmitted mainly through the sneezing, coughing, and by aerosol. But in case of monkeypox, which is a pox DNA virus, SARS coronavirus is a RNA virus. And DNA virus, this virus is very large in genome size, and also we don't see the mutation which we have seen during SARS coronavirus, which has gone through different variants and then variant of concern. So those.
Sorry, can I pause you to ask what might seem a rather lay and silly question to you, but is important in my view? You're saying it's not mutating. Why?
So I'm not saying it's not mutating, but I'm saying it will not mutate as fast and with the speed which we have is SARS, because it is a DNA virus which has its own DNA polymerase, and the rate of mutation or changes are lower. But recently, when these cases started, and now as we know that there are more than 17,000 cases across the world, and it is passing from one human to human, so there people are seeing some mutation, but there is not much significant which can bother scientifically people across the world.
No, from what I gather, there are apparently two strains of this virus. One is the Congo strain, the second is the West African strain. The Congo strain is more fatal than the West African strain. The Congo strain has a mortality rate of 10%. The West African strain has a mortality rate of only 1%, which means only 1 of 100 people, if they get the West African strain, die. 1 of 10 people, if they get the Congo strain, could die. Which strain do we have in India?
So, the outbreak which is started and spreading across the globe is caused by the West African strain, and India, all 4 cases which has been detected found the same strain, which is West African strain. Not only by the real-time PCR, but also by genome sequencing, it is confirmed. So I think that reduce worry also that we have less pathogenic or severe strain in India as it is present in the rest of the part.
The other thing that became really important at the time of the COVID pandemic was the R rate, the rate of transmissibility. You said that it transmits from one person to another. Is that the way it's likely to be, or could that go up or go down?
So at the moment, initially it was 1-to-1, but now there are some cluster of cases are getting reported, but still R0 is very low in compared to SARS coronavirus, which we have seen.
Why is it low, Dr. Shahid Jamil? I'm sorry, I'm glad that it is low, but just so that I understand, why is the rate of transmissibility of the monkeypox virus much lesser than the rate of transmissibility of the coronavirus?
Well, when you talk about R0 value, you talk about community transmission. So far, the monkeypox virus is transmitting in very close networks. So it's not really transmitting, at least so far, that much in the community. Although that's the next thing that will happen. It will get into the community. It's already getting in the community. If we see what happened in the Delhi case, it's probably a case of community transmission.
No, but if you were to look out into the future, where does the monkeypox graph go from here? Will it see like a sharp hockey stick-like increase? Will it be very gradual? How do you see the rate of increase of monkeypox cases?
I think it's difficult to say, but I would err on the side of caution. India being a country with high population density, especially in the big cities. I mean, imagine traveling in a Mumbai suburban train or in a bus in Delhi. You come into close contact with people, and this virus is transmitted through respiratory droplets. And there's a difference between droplets and aerosol, which is COVID transmission. So, it will spread, but I don't know whether it will be an exponential increase or whether it will be a more slower increase.
Let me put that same question to Chandrakant Lahiri and get his sense on whether we're going to see an arithmetic progression in the number of cases or a geometric progression, which suggests that there will be a much faster increase in the number of cases from here. Is there any way of knowing at all? How would you be determining your response to this question?
So there are two things which we need to remember to understand this aspect. One is that SARS-CoV-2, which spread really fast, is a respiratory illness. And this one, monkeypox, is not a respiratory illness, contact illness. So rate of spread is going to be slow. That's part one. Second part is that what happens in SARS-CoV-2, COVID-19, that even asymptomatic individual, the individual who do not have symptom, can pass on to other person, and that person can have full-fledged illness. But that is not the case with monkeypox. One of the good things in monkeypox is that person had to have symptoms to become infectious or pass on to other people. So if somebody has symptoms, you can identify, isolate that person, trace their contact. That's how you can slow down the.
So you're saying if they don't have symptoms, they can't pass the disease on. They can't pass the virus on.
Yeah. So asymptomatic individual cannot pass on. Only symptomatic person with symptom can pass on, and that is the reason everyone is saying.
Are symptoms always visible? Because I'm reading here that oftentimes the symptoms could be in the genital areas and therefore may not be visible. If you, for example, are in a bus or a metro with someone, you may not know that that person has monkeypox because it's in parts of the body which are covered by clothes.
That is true. Symptoms are not always visible, but you broadly know that contact illness spreads slower pace, and then symptomatic individual can pass on, gives us some assurance that we can identify early and reduce the rate of transmission. Putting that together, we need to also remember that once a virus is reported in any setting, for example, Zika virus was almost unheard 4 or 5 years ago. And then there were outbreaks, and now we know through a recent ICMR, Indian Council of Medical Research study, that Zika virus is in many states of India. Similar way, now monkeypox has been reported from the country, so we should be mentally prepared that more cases might come in days and months ahead, and virus might be reported from India in the long run. But we should not be immediately concerned or worried because of the reasons we have discussed. A contact illness, which can be effectively controlled, there is a medication available, there are vaccines available. All we need to do is strengthen surveillance, identify cases, and trace their contacts, and if vaccines and treatments are available, start putting on them. So,
no, but the vaccines aren't available in India. You're saying yes, vaccines are available, but that's in a very generic sense. In India, those vaccines aren't available at this moment. Dr. Suresh Kumar, I started with you, I'll end with you. Since you're treating a patient of monkeypox, and when we put out that graphic explaining all the symptoms, headache, body ache, swelling, how bad is it? Like, is this like a mild illness? Is this a severe illness? Like, how bad does it get?
We have this gentleman with the mild illness. Right now, there's no fever right now, but he had definitely the eruptions of skin eruptions, some of the vesiculopustular rash over the trunk and lower limb, and also on the upper limb.
Is it typically mild, or could it get much worse as well?
A headache, mild, only mild. And the fever lasted only for 5 days, and after the fever was over, then he had the skin eruptions. And now that is also in the crusting phase, and patient is recovering well, and he himself said that he is much better after hospitalization. Initially he felt some sort of body ache and headache and irritation in the eyes, but right now we have multiple consultation by the different specialties that he is fully recovering well, and he is getting SOS medicines. There is no need of any panic, and patient is comfortable.
Shahid Jameel, is it always mild, or could there be cases where if there is some kind of a comorbidity, from what I gather, if you have other, which is true for all illnesses actually, if you have...
It is true for all, yeah.
Yeah, but
it
if
is
you have...
true for all illnesses. I mean, there will be a variety of symptoms. And after all, the mortality rate is 1%, although in this case we haven't seen 1%. There are total confirmed 5 deaths globally out of about 17,000. So that translates to much less. One final point I wanted to make, Rahul, is that this declaration by WHO also makes it easier for patent restrictions to be smoothened out.
That's important.
For both vaccines and drugs. And therefore, if the government is listening, I would very strongly recommend that, considering our pharma and vaccine industry, we should get on with it and start making these.
Find your AstraZeneca.
Good for us, it will be good for the
world. Go out and get that vaccine as quickly as you can. Don't just sit around. Be proactive. I think that's the advice.
Not just get the vaccine, get licensed to make the vaccine.
Oh, absolutely. Get licensed to make that vaccine, and then not just give it to your own population, but also, like we're doing at this moment with the coronavirus, ensure that your vaccine is made available to others. This was a very important conversation, and I'm glad that we had sensible voices giving us deep insights rather than spreading panic or adding to the disinformation. For the time being, Dr. Chandrakant Lahiria, Suresh Kumar, Dr. Pragya Yadav, Ambrose Pradeep, Harish Iyer, and Dr. Shahid Jamil for joining me on the News Track special on the monkeypox. The first show we've done on the monkeypox in the News Track. Very significant that this is now a public health emergency. The good thing, though, as Dr. Jamil said, is that you can now use this to expedite the speed at which you get your antivirals, the speed at which you get your vaccines, and the speed at which you gear up to deal with this public health emergency.